Hello everyone, I'm Dr. Fiona Wu. I'm the Medical Director of our Urology, and today we are going to discuss about kidney stones, how they are formed and what we can do about it. So for most of our urological patients, most of them only know they have kidney stones when they feel a pain, usually at the side of the abdomen or at the back. So the thing is that when patients present with that kind of pain and when it is very severe, usually our first diagnosis will be kidney stones. Of course, there can be other diagnoses such as severe back pain, or for the right hand side, sometimes it might be gallbladder inflammation. So depending on what kind of presentation, how bad is the pain, we will need to do a proper diagnosis before we can help the patients. Kidney stones are formed in the kidney when the urine is supersaturated with certain substances such as calcium, oxalate or uric acid. These are the common substances that we see in stones. When somebody suspects that they have kidney stone, either because of the pain at the back, pain at the front, if they pee out a little bit of blood, or they have known previous renal stones, then they will need to visit a urologist or at least visit their family physician, because without a proper diagnosis of kidney stones, the patients may have complications. For example, when the stones drop down into the ureter, it can cause obstruction or it can cause very bad infection because the urine above the stone will not be able to pass the stone, and as a result, the patient will either have very severe pain, they may have fever, they may feel like vomiting, and in general they feel really sick, and that's when they seek medical attention. When we suspect that the patient has kidney stone, usually we will do some basic investigation. For example, we will take the urine for testing to see whether there's any infection, whether there's any blood, whether there's any white blood cells. We can also do a bedside ultrasound to see whether the kidneys are swollen, because when the stones drop down and cause obstruction, the kidneys will be swollen. A definitive test will be either an X-ray, a CT scan, or an ultrasound. But the best test, I would say, will be a proper CT scan, because even if the patient has already passed out one stone, there might be remnant stones, and we'll definitely need to rule that out before we can actively discharge the patient. So yes, all in all, I think any patient with suspected stone should at least get a proper CT scan of the kidneys before we can rule that out. A lot of people like to ask, how do they actually reduce the risk of having kidney stones? I think one will be good hydration. Usually in Singapore it's really very hot, so I'll advise patients to drink more water. Anything above 1.5 to 2 liters is really quite good. That's the first step. Okay, a lot of fluids. Number 2, reduce the protein intake and oxalate intake. I would advise patients not to take too much red meat and not to take any organs. In Singapore, it's quite common when we actually drink like pig organ soup or this. Try to avoid those because those are of high oxalate content. So as a result, they form stones more easily. Number 3, reduce salt intake. A lot of patients, they actually take in a lot of salt without knowing it. Our local diet is actually, not so healthy because of all our wonderful hawker food, right, or other cuisine. We actually have a high salt intake, and as a result, stones can form easily. And another favorite of our local patients, right, is peanuts and other kind of nuts. I would advise patients to have moderate intake of the nuts, because the calcium, the protein, and even the oxalate content can be quite high in nuts. So a lot of our patients, I found that they actually have a high intake of that. So try to reduce that as well. But I think all in all, right, the most important thing would be good fluid intake. And as for those patients with gout, I will also advise them to have good control of their uric acid. There's also another stone which is quite common in Singapore. That's uric acid stone. So for uric acid stone to form, right, usually it's due to a diet issue as well. So for patients with gout, please follow the gout diet properly, because it is very similar to our stone diet, and having a good diet actually prevents stone as well as gout attacks. So I think those are the most important things that I would advise patients.